So I have a very special guest in studio with us today, Gloria Freeborn, the Director of Strategic Initiatives and Development with BC Renal. So welcome, Gloria.
Thank you for having me.
So maybe we could start off and just, talk high level about BC Renal and its role, its mandate. I know it's really kind of the driving force of kidney care here in BC, and there's so much that BC Renal does. So maybe you could just give us kind of in a nutshell, what's the role, the mandate?
What do we do?
Who are you?
I like to think of or describe BC Renal as the hub for a network of care providers across the province, so in all the different health authorities around BC. Some of our essential mandate, our essential role is to plan and fund care delivery in the province to ensure that everybody has access to equitable care wherever they might be. We develop standards and guidelines to ensure best practices for kidney patients. We also measure and report both at the patient level and the system level to ensure that we're always improving care and doing what we can and showing evidence that we're improving outcomes for patients and their experience of care. We support research and quality improvement and knowledge translation and education. And we also have, in more recent years, been working to increase public awareness of kidney disease and kidney health promotion.
Well, that's a huge mandate. And one of the things that we do know about BC Renal is that it's received national and international recognition in terms of the model of care that BC Renal provides to patients here in BC. Can you talk a little bit about that?
Sure. I mean, I think foundationally, the key principle for us since we developed in 1997 has been equitable access to care. So the idea that no matter where you are in the province, whether you're in the Lower Mainland, you're up in the north, you're on the island, you have access to the same kinds of services, the same quality of services. So that's been key, and our ability to do that has been our ability to work as a network and with one voice to the Ministry of Health in our planning, to ensure that we have the funding required, to ensure that we have the information systems that will not only drive patient care on a day-to-day basis, but also support improvement over time and our ability to measure and evaluate, what we're doing, is it actually making a difference for people? And if not, let's course correct and do something different. And working as I said, as one big team. So, we have nurses and doctors and dietitians around the province who sit on our provincial committees and help drive some of those standards of practice and guidelines and whatnot, and also help support development of patient materials so that we can provide the education to patients so that they can get more involved in their own care and know how they can best support their own better health outcomes.
Among the many accomplishments that BC Renal has on its list, I know the medication, having access to fully funded medications is something that BC Renal is really a leader in across the country.
Absolutely, and so like as I said, when we're talking about working together as one team, as one voice to ensure that all the elements of care are there, and we believe that medications are a big part of that piece. And so we've developed what we call pharmacy formulary, so all the essential medications that we deem to be important for the delivery of care are fully funded, and we're the only jurisdiction in the country that provides that level of support for patients, so they don't have to worry about whether their extended health can provide it, or if they're not able to have an extended health program, that they know that they have access to the medications that they need. And that's a continually evolving world where we have pharmacists and other care team members from around the province who work together to assess and evaluate what medications are essential. And we can actually, through our provincial database, which I mentioned earlier, we can actually evaluate the efficacy of those medications and make changes as we go. So that's certainly one of the things that we're most proud of.